THC-CBD to treat muscle. See between cannabis oil is quite a challenge, and diagnosis and treatment consists of the attending physician. Usually this patient come first to the family doctor, who would the job of investigation and initial treatment. The spirit of traditional medicine, the doctor will clearly anamnesis, and direct the physical assessment of the patient according to the findings. No one will end the investigation and offered medical treatment, physical or otherwise. In cases where the diagnosis would require further clarification, the patient will be referred accordingly. The challenge in building diagnostics and treatment plan to the patient with muscle pain is adopting a practical approach based on the understanding of the formation mechanism of pain. Muscle pain fall into two main categories, muscle pain and muscle aches simplified. Within these two categories are different factors cause of muscle soreness to cases of muscle pain caused from depression, and muscle aches are a byproduct of taking drugs. Muscle pain is considered a deep pain, dull and difficult to detect accurately. More broadly, there are symptoms such as a burning feeling, especially in a high amount of lactic acid in the tissues, circumcised, and description similar to the description of nerve pain. Indeed, muscle pain as it sees the scientific community is pain injuries more difficult to characterize what other physiological challenge of tackling the entire medical staff. So when approached to review the issue of treatment of muscle pain through CME enough, we cannot review all subgroups because, as we have shown examinee, muscle pain can be the result of such injuries. Physiological, neurological and injury science has more trouble explaining totally, like depression causes muscle pain. With this we'll bring our overview the major players of the relationship of marijuana type CME enough muscle pain, and in particular how the scientific community says it can relieve those suffering from pain.